I want to welcome all of you to the National Academy of Social Insurance's webinar on the recently released 2024 Social Security Trustees Report. I'm Bill Arnone, the Chief Executive of the Academy, and we relish this opportunity to provide you, our members, and others with the facts on Social Security. And no one is better suited to do that than the Chief Actuary, Steve Goss. Steve will be presenting the highlights of this year's report, and then we'll have a terrific panel led by Rebecca Vallas, the Academy's distinguished fellow, senior advisor, and soon to be chief executive officer. And they'll be giving you a chance too in the Q&A section of Zoom to provide any questions you'd like us to address. We have a lot to cover and not a lot of time, so without any delay, I'm going to turn it over to Steve Goss. Steve, thank you again for being available as always with you and your team and the great work you do on this, the 84th Social Security Trustees Report. So Steve, take it away.
My great pleasure, Bill. Thank you very, very much. And I'm hoping we can present the slides. We can march through those because we have some wonderful discussion coming and the Q&A much to look forward to. So yes, the new trustees report is out, has been out for a bit. So wonderful to have the opportunity to talk to you. So can we just go to the next slide? This is just, hey, here we are. So on the next slide after this, just a real quick recap. Everybody's familiar with the Social Security Act, the one just prior to that, please, number 2. Everybody's familiar with the Social Security Act, which requires by law that the trustees, the Board of Trustees, 4 members of the administration plus 2 public members, when we have them, we don't at the moment, to make an annual report about the status of the trust funds. The most recent year's operations, the next 5 years, and the actuarial status of the trust funds, intended for what? To indicate to Congress what kind of financial actuarial status we're in, and when, if, and by how much any changes might be needed in the future, critical for the planning and the maintenance of the program. And by the way, the trustees reports have been produced every single year starting in 1941. So we're on the 84th one, as Bill said. So the next slide, please. You can see what are the primary things that changed in this year's report. Not really huge change, but there were significant changes. One is the economy of the 3 items that are really significant here. The economy was really stronger in late 2022 through 2023, and even so far in 2024 than had been anticipated by the trustees and in the trustees report, and everybody else, by the way, too, late in 2022 that led to the 2023 trustees report. Now revised, and you can see that there was an assumed 3% permanent drop in the level of productivity and GDP in last year's 2023 report. That has been restored in this year's report because of the very, very good year that we had in 2023 in the economy. Disability, another very good story that has significant effects on the trustees report. We've continued to have very low levels of disability applications and incidence rate. And on the basis of that, the trustees, because we make changes incrementally, have decided to take our ultimate disability incidence rate down from 4.8 per 1,000 people exposed being insured but not already receiving a benefit, down to 4.5 per 1,000. This is an historic low level for incidence rate, and lots of good reasons why that is the case. Demographic assumptions, this is the one that goes a little bit the other way. Along with disability incidence rates being very low, and in the recent times, we've had very low birth rates, very low fertility rates in this country. And the trustees have decided that we will take ourselves down to the lowest level we've ever assumed for an ultimate total fertility rate in the trustees report, to 1.9 children per woman over a lifetime. That being attained in the projection period by 2040 versus getting up to 2.0 by 2056 in last year's. Now, the combination of these factors improves our Social Security actual deficit, reducing it from 3.61% of payroll in the last year's report to 3.50% of payroll in this year's report. So the next slide, we can see a little picture of what we're actually talking about with the GDP. And if you just sort of look at the picture, some of our favorite things to do, you can see where we were on the black line on the last year's 2023 trustees report. You can see during 2023, GDP was estimated to be essentially flat. The expectations, not just of the trustees, but all of the private economic forecasters we're in late 2022 expecting a serious slowdown in 2023. The good news, if you look at the red line, is that it didn't happen. And so basically where we are at with the red line on the 2024 trustees report is historically we're back about to where we were in 2020 and 2022 trustees reports. We have a little bit of an assumed slowdown going on in 2023 and 4, but then rising back up to the level where we were in 2020 and 2022. We've got a serious re-estimation here of what the economy is doing. That's a very, very positive effect for the near term and for the long term ultimate, because this is a level shift up in the level of economic activity in the country, very positive all the way around. So in the next slide, we'll get into a little bit of the disability issues. Probably most are quite familiar with this. This is just to look at the number of Social Security disabled worker applicants applying. And you can see back, through about 2007, we were in sort of a steady state of about 1.5 million. And then along came the Great Recession. And by 2010 and 11, we had a much elevated upwards of 1.9 million applications coming in. And you can see all the little colorful lines from the various trustees reports that followed that. We were expecting, as we've seen generally in the past, that we would have a drop off in the recovery of the recession, but then it would sort of come back up to a steady state level somewhat higher. We had a lot of outside experts from the 2011 technical panel telling us they thought we should have very, very high incidence rates in the ultimate. So that's where we're having the high applications. We are now down, as you can see from the bottom right line on the red, to be a much lower level of expected applications in the future, following the remarkable history of the drop on the solid black line. A little bit of an increase in 2023, which we've been expecting for quite a while and have now seen. Now, the interesting part is on the next slide, really, for disability. This is not applications. The next slide is what we call the disability incidence rate. That's the actual number of people that go through the claims process and are awarded a benefit, again, as a percentage of those that are insured and not already receiving. And you can see again here, we have a little bit of a kick up here in 2023, going to the solid vertical line. And then we have a rather steep increase after that. And the steep increase after that to a peak around 2027, 2028 for new awarded benefits is because, as many are aware, we have had an increase in pending claims because of a shortness of staffing at SSA and at the disability determination services in the states. The assumption in the trustees report of the president's budget is that we will rectify that in the next 2 or 3 years, and we will be able to have a large number of new awards going on to that peak around 2028, 2029, and then getting back down to a steady state level lower than we've had in the past, at about that 4.5 disability incidence level. But the reason for expecting the lower disability incidence is not just that it's been low for a while, the changing nature of work in our economy, but also a really important factor, which is the changing age distribution. We have relatively fewer people at traditional younger working ages, and we have more people at higher ages. And what this has done, and we've heard this confirmed everywhere we've talked, is there's been more accommodation by employers in the workplace to allow people to continue working and to be working with some level of impairment that might have precluded their work in the past. So next slide, we get to the third item, which is the not positive story here. And you can see the history here of the total fertility rate. The total fertility rate actually is the dashed red line. That's the total number of children that would have been born. The sad part of this is you can see back up through the 1920s. And prior to that, there was a big difference between that actual total fertility rate and the modified or adjusted total fertility rate, which only includes children who survive to age 10. Infant and early mortality back before 1925, 1930, before World War II really was really extraordinarily high. We've virtually eliminated that now. As you can see, the good news is we're much better shape. The baby boom period you see back around the 1946 to 64 period was the high level, averaging what, 3.3 children per woman on a lifetime basis in that time. We had a brief reduction then from about 1964 up to 1990, but then we recovered back up to over 2.0, and that was the basis for assuming. Also, we still have birth expectation surveys done periodically, asking women in their 20s, 30s, and 40s how many kids they have and how many they might have in the future. That's still at about the level of 2 on average. So we have some reason to believe that from these very low levels we've been seeing recently on the total fertility rate, that we will have some recovery back. Will it be up to the 2.0 we've been assuming for a while, or only up to the 1.9 we're assuming now on this incremental change? Only time will tell, but incredibly important for the future. So next slide, we can see our usual little representation of what is happening with the trust funds. And you can see the really good news here is on the blue line for the disability insurance trust fund. Not just because of the economy, but largely because the lower disability incidence rate. You can see we've moved from the dashed blue line, which is very positive for the trust fund ratio. Trust fund ratios, for those who are not recalling, is the amount of money we have in the trust fund reserves. We oftentimes call it the contingency reserve fund, as a percentage of the annual cost of the program. And the best target on that for a program like this is to aim to have at least 100%. So you have a cushion or a contingency in case we were to hit a recession or anything like that in the future. But you can see from the dashed line to the solid blue line, we've had a really, really big increase. So we are more than adequately funded for the DI program. Now, on the red line for the OASI program, we're at a high level for the trust and reserves right now, over 200%. But we're dropping rapidly because of the aging of the baby boom, et cetera, et cetera. But you can see we're a little bit better off this year. For the OESI program, we're projecting that rather than April of 2033 reserve depletion, it's moved out to November of 33, the same year, but later. For the combined fund on the black lines, the story's a little bit better because that's aided by what's happening in the disability side, and we're moved out by 13 months later from, I think it is May of 2034 out to June of 2035 expected reserve depletion. So we do have some very positive effects this year. Incremental, a lot more needs to be done though. Next slide, please. Great. This is a little bit different look. Everybody, I hope, is very familiar with this. This is the cost expressed as a percentage of our taxable payroll, our tax base. That's all the earnings everybody here has up to the 168,000 and change taxable maximum. And you can see the red line is our revenue line or income line, and that's right around 13% of payroll. It's basically the 12.4% tax rate plus the little bit of extra money we get from revenue from income tax on benefits for many beneficiaries. The blue line, however, is the cost of paying out the full scheduled benefits, and that drops off. You will see in 2035 why, because that's the point at which, under the law, Social Security, if it did not have enough money in the trust funds to pay the full scheduled benefits, it simply cannot do that. So the actual expenditures would drop down to just what was still coming in after reserve depletion in 2035. We obviously do show the dash blue line, which would be the full cost of paying the full scheduled benefits on a timely basis, which again would not be possible. Well, as a reserve depletion in 2035, we would be able to still pay 83% of the scheduled benefits. It was estimated to be only 84 at at 80% in last year's trustees report, so we're up to 83. However, because of the eventual effect of the total fertility rate being a little bit lower, we're at 73% in 2098, where it was 74% in last year's report. So the next slide, we see this is just a little bit more of a look of the annual balances. These are the annual balances, which are actually, unfortunately, a negative. This shows that our cash flow, not counting interest, is such that our expenditures are more, or our cost is more than our income. But you can see the red line. We have less of a deficit this year. Early on because of the economic and disability, but eventually these two cross over around 2077. Why? That's simply because the delayed effect of the lower birth rates on the age distribution of our population eventually overwhelms the small positive effects we've had in this year's report compared to last year's report, which is the blue line. So by 2077, we move in the other direction, and the fertility rate change dominates the positive on the economic and disability. So on the next slide, great. This is something we always like to talk about, not just solvency for the program, where if the trust fund reserves become depleted and we have only the continuing income, we won't be able to pay full benefits. This is just to illustrate what the cost of this program is as a percentage of GDP. Many are much more familiar with looking at the costs of federal programs and all programs in that context. And you can see rather than being the the low to mid 4% where we had been for a long time, with the progression of our age distribution, largely because of the drop in the birth rates, we're going to go up to around 6% of GDP. The big question is that where our society, our Congress, our representatives are going to want to be? Are we going to move revenue up, the blue line up, to meet the cost, to maintain the kinds of benefits we have scheduled currently in law? Or are we going to pull the cost line down to the level of revenue that we have scheduled in current law now, or somewhere in between? So the next slide, uh, we're one thing we should note here is we're facing a different situation now than we had back in 1983. 1983, the projections after those amendments were to be the early 2060s reserve depletion. Now we're looking at the mid 2030s, almost 30 years earlier. Now, this is not due to increased longevity. Wonderfully, the projected life expectancy at age 65 that we had back in the 1983 report for those determinations was extremely accurate up through at least 2015. Much after that, we get a little bit complicated because of the pandemic, but our projections for life expectancy were very accurate. So, what else is going on here? On the next slide, we can see the thing that we oftentimes look at, which is the aged dependency ratio. This is just the number of people 65 and over, oftentimes thought to be a reasonable, approximation of where we are with our beneficiary population, good representation, and the 20 to 64, kind of a proxy for the working age population. And you can see this is moving along and increasing somewhat over time up through about 2010, just with increasing longevity having some effect. But after about 2008, up through about 2040, we had this dramatic increase. Everybody's very familiar with that, simply because of the big drop of the birth rates. And just to really illustrate that it's the drop in the birth rates, look at the blue and red lines, which are, if the birth rates had stayed at 3.3 children per woman on the red line, or 3.0 even, which was kind of a longer term past average, you can see what this age dependency ratio would look like. We wouldn't be talking about these big deficits for Social Security that need to be addressed. So really, the big factor that is really facing us, and why we're facing these issues, is because of the changing age distribution of the population, because of the birth rates. However, as indicated on the left, this was also known and anticipated back in 1983. So, what has changed since 1983? The next slide gives us a good idea. So, on the next slide, we see something that we're all very familiar with, that the earnings distribution amongst workers in the economy has really changed a lot. Between 1983, when taxable maximum level for Social Security was set with the intention of having about 90% of all covered earnings being above the tax max, and that's what it was initially back around 1983, 1982. What happened since then? Well, by the year 2000, there was a big shift in the earnings distribution from high earners to low earners, or actually from low earners to high earners, you might say, where we dropped from 90% down to about 82.5%. And you can see the 82.5% for the year 2020. It moves around a little bit. Our recessions have effects, but you can see it's been basically at around the 82.5%. We expect it to stay there in the future, as it's been since about 2000. The reason why this happened, just a little interesting metric. If we look at the top 6% of earners across time, they had real increases in their average earnings. Their average earnings, over and above price inflation, CPI, was increased by 62% over the 17 years from 1983 to 2000. For the other 94% of workers who are not in the top 6%, their increase was only 17% over that period. So it's that shift of total earnings to the highest earners, where that shift went largely above our taxable maximum because of the way the law is structured for that, that we have missed out on a lot of revenue that was expected to be subject to the payroll tax. Something to be, and by the way, this was obviously not anticipated back in 1983, and it's largely the reason why we've moved from the mid 2060s back to the mid 2030s for the reserve depletion date. So next slide, please. Ah, so we have maybe a few minutes here to just sort of touch a little bit on some of the myths, if my watch is correct here. Uh, and these are some of the myths and sort of facts about them that we talk about a lot. And, Bill and I and Rebecca and everybody thought, might be useful to sort of include some of these. Michelle Singletary sort of touched on a couple of these in the Washington Post very recently. So if we have a few moments, let's just sort of flip through a couple of these. So if we flip to the next slide, we see One common myth is Social Security is bankrupt. I think one point in time, somebody said flat bust, insolvent, running out of money. Well, actually, no. That's the facts are that Social Security cannot run out of money because remember, with all the revenues that come in and under law will continue to come in, even if we have reserve depletion, we can never spend more than we have available in the trust funds. So Security does not run out of money. It might become a little bit short on cash flow and may not be able to pay the full scheduled benefits. But even if Congress does allow, as B says here, trust fund reserves to become depleted, the continuing income, as already indicated in 2035 on a combined trust fund basis, would still be 83% of that schedule. That's a long way from no money and no benefits. Now, it deteriorates a little bit by 2098 down to 73%, but of course, this is the call to action for Congress between now and 2035. Over the 80 plus years of Social Security's existence since 1940, the first monthly benefits were paid in 1940. Congress has always acted timely. Scheduled benefits have always been paid in full and on time in the entire history of the program. So we're waiting for Congress to come to action. Lots of possibilities, and we're sure they will, as they have always in the past. Second myth on the next slide is increasing longevity and disability are the problem. Well, as already indicated, that's not right. The increasing longevity that we have had was fully anticipated back in 1983. Disability is not a problem. In fact, disability is doing better than expected, as you've seen on some of the earlier slides. The big issue is population aging. We sometimes call it macro aging, because when people hear an aging population, they usually think, oh, we're living longer. Well, the aging of our population is really the change in the age distribution. That is really what is leaving us with the shortfalls we had that were anticipated in the mid 2060s and early 2060s, even back in 1983, and now earlier. Earlier, why? Again, because the shifting distribution of earnings amongst earners. Disability costs have been dropping, so we've got some good news here, but we have a challenge ahead of us. So on the next slide, myth number three, money in the trust funds has been spent. We've probably all heard this many, many times. Well, actually, the the law requires every dollar that comes in revenue on literally a day by day basis has to be immediately invested in interest bearing securities backed by the full faith and credit of the United States. I'll bet everybody on this webinar has or has relatives who have some treasury securities. There's a reason treasury securities have low yield, because they're taken to be the absolute benchmark of security for the future. No better place to invest than U.S. treasuries. So that's where all of the trust funds are invested. That money is there waiting for us. Just like money that you might invest in your local bank, it might be loaned out to somebody to buy a car or to buy a house. Well, that's not spent. You will still get your money back when you need it. And it's the same thing for the Social Security trust funds. They're not worthless IOUs. They've always been made good when we need to redeem them, and we redeem them every day for paying out benefits. So Social Security benefit securities, they're issued at market yields. There's no arbitrage here in either direction. The trust funds are not shorted or getting an extra good deal on the yields. It's exactly what the long-term rates for marketable securities are out there. The trust funds, when need to be redeemed, which we do for every time we pay benefits, they've always been honored, and you can be quite certain they always will be. Full faith and credit of the United States government. So the next myth, number four, a lot of people say, "Ooh, when should I start benefits? Maybe as soon as I can." There was a lot of talk about this for a while of people thinking they were concerned that maybe the trust funds would run out of money, and so they better get it while they can, all they can. Well, as we know, that's not true. Uh, Scheduled benefits have always been paid, and moreover, when changes have been made that affect the future, they've virtually always been made in a way that only affects people who have not yet become eligible for benefits. As everybody here surely knows, the structure for changing the level of benefit you'll get as a retiree, whether you start at 62 or at 70 and receiving your benefit or anywhere in between, is designed to be structured so that on average, over your lifetime, you'll get about the same value of benefits in total. So it's a very personal decision as to when you should start. Maybe depends on what your doctor told you most recently. Do you look like you have a good life expectancy? Or maybe you have some issues, you might want to start earlier. Very personal decision. There's no way that anybody can give strict guidance across the board on this. And as we all know with the delayed retirement credits, if you delay working, by using other assets or because your job is so good that you have no need to file for Social Security benefits, this simply will increase the monthly benefit that you will get when you do file for benefits. It's a way of actually purchasing a larger life annuity at terms that is nowhere else available, not in the private market anywhere. So Social Security offers some real great opportunities here. Next slide, please. Number 5, tax contributions have been saved up for me as though it is literally like a bank account. Well, no, this is a pay-as-you-go system. We refer to it usually as a social contract across generations. The benefits paid today really are financed by recent contributions by today's and yesterday's workers. So it's really pretty much a pay-as-you-go system. And that is why the age distribution of the population is so critical and so fundamental. The changing age distribution that we have does present a challenge to us. It is something that we need to do. And by the way, just a little note on the bottom here, advanced funded systems are really kind of the same because if you put all your money away in stocks or bonds, and then when you go to retire and you need to tap in to that portfolio, the value of those will be determined by the demand for those in the market. If there are relatively few people working and wanted to buy your bonds at that time, the value may not be as high as you think. So we really live in a pay-as-you-go world all the way around. So myth number 6, on the next one, uh, scheduled benefits in the law will be all I need. Well, you know, we do have what we've always referred to as the three-legged stool. Social Security, your own personal savings, and employer-provided pensions. And financial advisors have always said that in retirement, getting something like the equivalent value of 75 to 80% in retirement of what you were earning, of your standard of living while you were earning, is perhaps adequate. You won't need to be buying as many fancy clothes once you retire, won't have the commuting costs, et cetera, et cetera. Now, Social Security provides about 40% for career average earners, which means there's a long way between that and what you should have. So people obviously are encouraged to hopefully have an employer that will provide a pension and also to have some savings. However, this varies from about 20% to 70%. The other legs of the stool, personal savings, private pensions, are really important, but increasingly Social Security really has become the primary source. We see on the next slide an interesting little, I usually call this the X chart. No, I'm sorry, this is I'm thinking one slide ahead. This is the replacement rates. And this is where you can see the roughly from a little bit above 20% for our maximum earners. Maximum earners only get a benefit equivalent to about 23, 24% of, or a little bit less than that, of what their career average earnings were. So Social Security does provide a benefit. Social Security has been designed to provide a reasonable rate of return for the contributions people have been putting in across the board, but it is a progressive system. For the very low and the low earners, the replacement rates are considerably higher, above the 40% for the average. And that's intended because people with very low earnings have typically had much less opportunity to have savings during their lifetime, so they really need more from Social Security. But on the next slide, we can see part of the reason why Social Security and your personal savings are important. This is, goes back to Ebry and Dallas Salisbury days, providing this to us, and we've sort of updated it over time. You can see that on the top purple line, only about 50% of all people employed are in a employer-provided plan, either a defined benefit or a defined contribution 401k type plan. Only about half of all employees. That means that Social Security is it for all the rest of the workers. And the other interesting thing is, if you look at the blue line, that's the number of people in a defined benefit plan that would probably provide an annuity for you from your employer when you retire. This is the kind of plan that Social Security is. You can see that's gone from 40% down to only about 10 or 12% in more recent times. So defined benefit plans have gotten replaced by what's on the red line, defined contribution 401k type plans, which do not provide life annuities, and they're not secure in terms of the money necessarily being there. You might have to tap in them along the way. And the green line shows the number of people who really have both, which has been at a very low level throughout. So clearly, with less than half of people having any 401k or defined benefit plan from their employer and increasing it being to a 401k, the importance of Social Security becomes all the more important over time. So the next slide, please. Myth number 7. Social Security is responsible for the federal debt. This, I wish we had a lot more time because it'd be fun to get into this. And the bottom line is Social Security cannot borrow. It's not allowed to under law, and it never has borrowed from the general fund. In fact, Social Security's positive reserves actually help finance part of the total federal debt that the rest of the government has accrued. There's a budget scoring convention that says that after reserves are depleted for Social Security, to make an assumption, this is curious, that there will be a change in law that will say that any shortcomings, any shortfall on revenue for Social Security and for Medicare HI will be made up by transfers from the general fund to the Treasury. Well, the law does not permit that. So there's this change in law assumption by this budget scoring convention. And the basis for it, we are told, is what you see below, this Section 257 of a 1985 Act that says that for scoring, scorers should assume that all payments will be made that are required by these laws. Now, here's the key. After reserve depletion, the law prohibits Social Security from paying out benefits that are not able to be paid out from what is in the trust funds. So if the trust funds become depleted, not only are benefits at the full level that is scheduled not required, they are not even allowed. So the basis for this budget scoring convention is really, well, questionable, shall we say. And on the next slide, we can see sort of what the implications are. On the next slide, you can see on the left is CBO, on the right is the president's budget 2025. These are the most recent items from each. The black line shows you on each of these what the history and the projection is by these two entities for the publicly held debt. Now, if you first focus to the right into the projection, the publicly held debt in both cases includes this presumption after trust fund reserve depletion for OSI or DI or HI, what will happen in terms of the amount of money is being suggested by some mysterious change in law that will fully finance those programs. That is included in the black line. If we in fact follow actual current law in the projection and state that under current law that cannot happen, then we get down actually to the red line. That is if we do not make this presumption of money rolling in from the general fund of the Treasury to fully finance shortfalls for OSDI and HI, you would be on the red line, which instead of rising to under CBO 166% of GDP, would rise up to what? Maybe at most about 130%. Now, that's still an increase under the president's budget. We can see actually instead of rising up to 120%, it would actually drop back down to about 100%. Now, the other little interesting thing in this, the black line shows you that as of right now, we're at about or a little bit below 100% of GDP for the publicly held debt. But that depends on how you define publicly held debt. Are the trust fund reserves, which are saved up money from payroll tax contributions that are sitting there on the behalf of the public to pay for future benefits for them, is that in effect publicly held debt? It covers a portion of the now what $33+ trillion of total federal debt. So when you look at that, you can see we're actually at about 110% of GDP for the total federal debt. And under CBO, that's going to rise up to maybe 130. Under the president's budget assumptions, it'll actually drop back down to about 100. So is there really this kind of pressure on the debt that we hear so much of? Maybe, maybe not. So the next slide, I realize we are at time here. So fortunately, this is myth number 8, which is Social Security's shortfall will be hard to fix. And as we know, it is a challenge. By 2035, we're going to have to lower scheduled benefits by about a quarter or increase the revenue by about a third or some combination. Our Congress will be getting there, and they will be listening to what the American people want. Many options already being considered. So on the next slide, maybe we'll skip these couple of slides in the interest of time. More of discussion about this, some of the ways that we have talked about. But the very final slide I really want to share with you, which is how to find Social Security's Office of the Actuary. All the material that you've seen here, this presentation will be posted later today, and lots of other material, including all of those 84 trustees reports, are available up on our webpage. So please be a visitor often. And thanks so much, Rebecca and Bill for the invite, and much looking forward to the discussion now.
Thank you so much, Steve. Oh, folks are loving your slides, and we've got lots and lots of questions in the Q&A actually asking for your slides. So really glad to hear that you're going to be posting them online, and we'll follow up with you afterward as well to see if we can post them at the Academy to make them easy for our members to find. So thank you, Steve. Steve will be sticking around. So folks have already been putting Q&A in the Q&A function. We don't have the chat open, but we do have the Q&A open. So keep on throwing, as my lights go out, keep on throwing questions into the Q&A. Steve's going to be sticking around, and we'll be taking some questions after we do some quick reactions from our panel. But hey, everyone, Rebecca Vallas with the National Academy of Social Insurance. Really great to be with everyone today. So grateful to Steve for taking the time to help walk through some of the facts from the trustees report and also all of those myths and facts. Steve, you're so good at that piece, especially. It's a pleasure to be with everyone today. And now what we're going to be doing is switching gears. And I'm actually going to welcome our fabulous panel onto the virtual stage with me. So there's Nancy Altman with Social Security Works. I'm going to welcome as well Tracey Gronniger, there she is with Justice and Aging, and Joel Eskovitz from AARP. So huge thanks to our fabulous panelists. We're really pleased to be joined by all of you to help us put all of what Steve just shared and all of the buzz around the trustees report from the past week and change into context and really to help bring it back to people and to policy. I know we've got a lot of folks who are really excited to hear more from Steve and who have specific questions, and I know they're all going to benefit from the context you all are going to provide as well. So what I'm going to do is just give each of our panelists a quick chance to react a little bit to some of what Steve just shared, but also, as I said, to bring it back to people and policy, because as much as we all love to think about all the numbers and the facts and the figures and the charts, of course, Social Security at its core is about people, right? And we wouldn't be talking about the trustees report projections if it weren't really the context for, well, what are policymakers going to do to ensure that Social Security stays on firm footing for the long term past 2035? And that's really the transition we're going to make in this conversation. So Nancy, I'm gonna bring it over to you first. As I mentioned, I'll give you just a chance to react to Steve's presentation in any way you want, but in particular, something that I know that you're going to be really well positioned to speak to is, what do we know about what the American people want from lawmakers when it comes to keeping Social Security on firm footing for the long term? So anything you want to do to react to Steve, but especially helping us bring it back to, what is it the American people want?
Excellent, excellent framing for this. And as Steve's presentation, I think, and as this trustees report this year is in the past, the trustees reports have always informed policymakers, and that's what they're doing again. The percent of GDP, 6%, they're at the end of the 21st century, clearly affordable. The point about lower fertility, and that there's an easy solution to that, although policymakers are not always connecting the dots, and that is increased immigration. In fact, the actuaries have great resources about the amount and within the trustees report a sensitivity study and so forth. But then getting it back to sort of policy and what the people want. Another myth that has been perpetrated in a lot of the media coverage that could be added to Steve's list is Congress is doing nothing. I mean, there is a lot actually going on. First of all, there is no question that Congress will act. There is not going to be a 17% across the board increase all of a sudden. That, as I say, not only will everyone get voted out of office, they'd all be run out of town and wouldn't be able to walk down the street. But there are a number of proposals that have been put forward, but unfortunately, they're all by Democrats. On the other hand, although that sounds partisan, there is as bipartisan as you can get, because there have been an enormous number of polls, recent polls in the past. The polling all comes out the same, and this is overwhelming numbers of Republicans as well as independents and Democrats recognize another point that Steve made in his slide about the disappearance of traditional pensions and the inadequacy of 401ks. There've always been a large number, half the workforce, that had only Social Security. But that's becoming more and more the case, and will be more the case in the future. So and of course, thank you, Bill. The National Academy has done some of the most groundbreaking work on that, about what people want and about the desire to not have benefits cut. What Congress, I think, recognizes is that as important, or the Democrats, I should say, what the Democrats recognize is that as important as restoring Social Security to long range balance is, it's a means to an end. The goal is to provide um, basic economic security. And most people believe, the overwhelming number of polls are, that benefits are too low. So there are a number of proposals that have been introduced in Congress. There have been hearings, and the actuaries have costed them out, that restore Social Security long range balance, or in one case, restore it for decades. There's a White House Boyle bill. There's a Sanders Schakowsky bill that raises benefits by $200 a month for just about all beneficiaries, plus some targeted increases. There's the John Larson bill that all does that. And they all focus on the ultra wealthy, which is, again, as Steve points out in his presentation, that was the unanticipated cost. The Economic Policy Institute has said that Social Security should have gotten $1.4 trillion of increased revenue that it did not get because of that. So that's what these proposals do. They can restore Social Security long range balance. They are extremely popular. And if election is an election issue, which I think the Democrats want it to be, it should be a voting issue. And if it is done transparently, not behind closed doors, I am confident there will be legislation this decade, well before that action forcing event in the early 2030s.
And Nancy, thank you so much for all of that. I'm just going to throw you one quick follow-up question, because here you are sharing really helpful polling, and I feel like that's it's helpful to kind of bring the conversation again back out of just the math problem, and back to what is it that the American people actually want from our leaders when it comes to addressing the question of Social Security's long-term solvency. You mentioned the payroll tax cap. Steve spoke about that, and I think we're going to hear more about that in a moment from Joel as well. But what is it that we know? What do we know about what the American people want, and particularly what people across various party lines might want when it comes to voters, when it comes to where the payroll tax cap should be, and how that plays into Social Security's long-term solvency?
Well, since only 6% of American workers are have incomes or have earnings over the cap, most workers don't even know it's there, because they just have deductions all year long. So when they hear about it, they're often angry about it, because it is a regressive structure. My very favorite poll is one that was done in March of 2016 by Pew, where they asked voters. At that point, it was Sanders and Clinton on the Democratic side. The primaries were still going on, and Kasich and Cruz and Trump on the Republican side. They asked people who they were going to vote for, and then what their opinion was on a range of issues. And all of them were extremely predictable, except for the one on Social Security. And they are all the dots, and all the voters, even the ones for Cruz, were all circled around Bernie Sanders' position, which is definitely no cuts, zero cuts of anyone. They try to say, oh, the high income, that's people with $80,000. No, they need Social Security more than ever. And ideally, um, have the ultra wealthy contribute more. But as the Academy's poll showed, that if necessary, people were willing to pay more themselves if they to avoid benefit cuts, and certainly they favor expansion.
Thank you so much, Nancy. And Joel, I'm going to bring you back up on screen now to join the conversation. And Nancy, feel free to stay on the virtual stage because we're just going to keep adding people until we bring it into audience questions. Joel, you and AARP have also looked incredibly closely at this trustees report you do every single year. Steve and Nancy have been speaking a little bit about the payroll tax cap, and Steve showed that really helpful slide. Helping us understand a little bit of how we got here to having this conversation about Social Security solvency, maybe a little bit sooner than had been anticipated in, in 1983. This is something that AARP has looked at as well. I'm curious if you want to add anything on this point from AARP's research, or if there are other reactions you want to bring to the table from Steve's presentation.
Sure thing. Thanks, Rebecca. Yeah, I mean, I find it reassuring to hear from both Steve and Nancy about what was and wasn't anticipated in 1983. I think it's really important to note that, we expected to be here. Maybe it's a little bit sooner than we expected, but we knew that when the baby boomers, moved from paying into the system to then claiming as beneficiaries, that there would be, a drain on the trust fund. We expected that. So we did not know, I think, in 1983, and that's what Steve highlighted was both. We didn't realize that we would be in a long stretch of low fertility that has really continued since then, since the late 70s. And then we did not know this large amount of wage growth above the tax max. That's the amount of wages that are taxed for Social Security. So this year, if you make above $160,000, you pay taxes on that first amount, but once you hit 160, you pay no more. And we've commissioned work at AARP from Richard Johnson at the Urban Institute, showing that if that cap had stayed at the historical level, which, as Steve alluded to, covers about 90% of all wages, we would have solved a quarter of our long-term financing challenge right there. So, had that cap grown as fast as wages have grown. So that I think is one area that we should be looking at going forward. And I think the other thing that really warrants highlighting at this stage, we're still about a decade out, is what problem we're trying to solve now. Because if you've worked in the Social Security space for a while, you're used to the idea of people saying, well, you look at, you can make some small changes on the tax side, small changes on the benefit side, we can fix the problem. But now we're about a decade out, and I really think you have to start thinking about how the changes kick in and the timing of those changes. I tried to make this point rather inartfully in the Washington Post last week, but the point I was trying to get at was that if you get revenue into the system quickly, that's going to be the most viable route to pushing that 2035 date out. That's not to say that a solution won't involve changes on both sides of the ledger, but if you're focusing only on the benefit side, that's not going to help anything on the 2035 date. So if you're thinking about making changes, say, to the retirement age, you're talking about a solution on a long-term problem. And we're still raising the retirement age today from the 1983 reforms. That's 40 plus years ago. And every proposal you hear about raising the age is holding people harmless, that are in or near retirement. So we're decades away from even recouping any kind of benefit from a change to the retirement age. And that's if you consider that to be a viable option. And, there are a lot of concerns about raising the age. I think the Academy has done a tremendous amount of work around this. We did this study last year around the people who do physically demanding jobs. Certainly, I'm in a job, I'm literally wearing a white collar. So I can work longer, but people who do physically demanding work cannot necessarily work deep into their 60s. And so the idea of raising the age for those people is in effect a benefit cut. I mean, it's a benefit cut regardless, but they will feel it the most, and they're the people who rely on Social Security the most. So I think it's important to think about, how raising the age and changes to the benefits really impact people, and even what the responses to these things are. As Nancy mentioned, there are Democratic proposals out there. Senator Cassidy put out a proposal, but not in text. But even in putting out the proposal, he had to reduce the retirement age a couple of times because of what one would assume is strong pushback against raising that age. So I think it's just important to think about, that is a solution for potentially a different problem than the near-term problem that we have in 2035. And it's a separate, I think it kind of distracts from the current problem that we have, which is how to get revenue into the system to stave off insolvency in 2035.
Joel, thank you so much for all of that. And Tracey, I'm going to welcome you onto the virtual dais as well. And you're going to help round us out before we go to audience questions. We've got a lot of good Q&A coming in, so keep it coming in the Q&A section. And Tracey, so just especially in the context of the annual trustees report release, I personally, I find it unfortunate that a lot of the conversation on Social Security really does start to get reduced to a math problem, right? We have a budget problem to solve and everyone starts talking about the numbers. And it's not to say that we don't actually need to deal with the numbers. The numbers are important. We need to make the numbers work, but help us bring the conversation back to people, which I feel like is what Justice and Aging is so good at doing. So what is it that we know about the seniors and the people with disabilities who rely on Social Security, which I feel like Joel gave us a great segue, right? What problem are we trying to solve? And Nancy spoke about this too, right? This is at its core about economic security. What do we know about the seniors and the people with disabilities who rely on this program, and what does it mean to them? And what does it mean in their lives?
Yes, thank you so much, Rebecca. I am happy to not talk about the math problem and talk instead about the people, because I agree when I'm thinking about kind of my work, I am at Justice and Aging and I'm focused on older adults in a lot of ways, but I'm also thinking about kind of our community as a whole. Social Security, obviously, it lifts so many seniors out of poverty, millions, anywhere from 16 to 20, depending on what figures you're looking at, but it is also helping all people. There are children, there are adults with disabilities, there are kind of their families, all of these people who are being assisted by Social Security, who without it would be living in poverty potentially. It's a really critical program. The way that we think about it, I think, is really important. And I really loved in Steve's comments how he talked about the social contract and how he talked about, the importance of this program being for everyone over the course of their lives. They're contributing to it, they're benefiting from it. They don't necessarily know when that's going to be, but someone or you yourself are going to be affected by Social Security. Some of the people that I think about when I'm thinking about who are being helped is older women, and in particular, older women of color. Think about the social contract with women who are oftentimes caregivers and providing all of this support to the community. And then as they age, they may be aging into less economic security than they would like. And because of Social Security, we're able to say, here's income so that you don't have to live in poverty. Here's an income so you don't have to worry about how you're going to be able to afford housing and food and clothing, whether or not that clothing is the most, modern and hip of the day, as Steve might say. But it's really important that we have this program and that we have this out there so that people have some sense of security and some sense that as a community we've decided that it's important to not let people live in poverty. For people with disabilities, you never know if, when, how you may be impacted by disability. It may be you personally, it may be family members, and to know that there is a program out there that says, we care about all people in the community. And if you have a disability, we're not going to say, oh, well, I guess you're just going to have to live in poverty. Social Security is vital for people with disabilities, and it's vital for the people who support them. And so I think that as I think about, how we view Social Security, in some ways, I think there may be a taking for granted of the fact that we have a program that does ensure that people are not just going to be left, by the wayside, but we also have to support it. We have to support the program. We have to support the agency so that it has kind of the funding to be able to provide the benefits that are so important. And we really do have to be thinking about it as a whole and not just, as you said, the math problem. What are the numbers? No, look at the people. If you look around you, you look at your parents, you look at your grandparents, your cousins, all the people, your neighbors. There are so many people who are touched by Social Security. And I think that keeping that in mind and thinking about what we want to do as a society is really critical. And I think, as you say, like, I'm not going to go into the math, I'm going to go to the people always. And I'm going to say, what do you want for yourself? What do you want for your community? What do you care about in terms of making sure that people are not left just to, like, who knows what, who are left behind? So that's where I'll stop.
Thank you, Tracy. Thank you so much. So, Steve, I'm going to welcome you back on camera because we've got lots of questions. I think some of which are probably going to be most targeted at you. So, thank you, Steve, for joining us again. So, I feel like the question we've got to start with that came through email is, and this is sort of the $1 million question. Everybody who hears the trustees report comes out and maybe isn't sure what it means for them wants to know the answer to. So, here's the question, and Steve, I'll give you the chance to respond to this first, but I have a feeling, Nancy, you may want to get in on this too. For people who are already receiving Social Security retirement benefits, can they expect a cut in benefits if Congress does not act before 2034? These people will be in their 80s in 2034. They need to plan. What can they expect? And I think there's like a general question around that of, should we expect that there are going to be benefit cuts at the end of the projected window that you've put out there, or do we expect Congress to act? So, Steve, I'll let you react to that first, and then Nancy, I'll kick it to you.
Thanks, Rebecca. A huge and important question. On the premise, that, which has never occurred before, that we reach reserve depletion and the Congress fails to act to shore up the ability to continue paying the benefits, if that were to happen, we do not have precedent for that under current law. All we know is that we would, as a whole, Social Security and Treasury would be able to pay out only 83 cents in total for every dollar of scheduled benefits. Exactly how that would play out is not clear. Benefits could be delayed a month for a while or delayed 2 months. Not a good option. People have to pay rent. It could be that benefits would be reduced across the board for everybody by 17%, or they could be reduced in some other fashion. That would be to be determined, and again, there's no precedent for it. The one thing we should be quite confident of, however, though, is that the Congress will act, that this will be fixed, either maybe making some modification in the level of scheduled benefits, primarily for people not already in receipt of benefits at that time, but only for the future. That has been the pattern in the past. So people who are in receipt of benefits now should have a very low possible expectation that their benefits will be affected by this in the future. Anything is possible, but history suggests that will not be the case.
Nancy, anything you want to add?
Just to add, 1 out of 5 Americans receive Social Security benefits. 1 out of 3 households, millions more are approaching retirement. It is a very, very strong voting bloc. Social Security is universally loved. So the idea that Congress will not act and will allow this to go in is, as I say, it's just not going to happen. It's unfortunate that part of what Social Security is supposed to provide, in addition to the intangible benefit of cash, is a sense of security, of peace of mind. So let's hope that's one of the myths that we should get rid of, that Congress somehow is not going to act.
The next question I'm going to throw out comes from John Tambernino. Hi, John. Thanks for joining. And Steve, this will be for you. Have the actuaries modeled how investing a portion of the trust fund in equities or a higher yield portfolio could contribute to restoring solvency? This was proposed by President Clinton and Bob Ball, but receives less attention now.
Oh, indeed we have. And in fact, if you look at the history under proposals on our webpage, indicated in the last one of the slides, there was actually a Bob Kerry Allen Simpson proposal back in 1995 that would have included investing a portion of trust fund reserves in private equities like the stock market. Similarly, Bob Ball back in the 94 to 6 Advisory Council had recommended that, and we have scoring of that available. So this has been considered many times before. Most recently, Senator Cassidy has suggested the idea of having investments as such. So we do have information up there on the web. That would certainly be a positive. It basically would give a higher yield on the reserves that we have. But of course, at this point, we have, dare I say, only $2.8 trillion of reserves. So that would be of some help. But every little bit of help helps.
Here's another question that's a little bit more about knowing the history so that we can anticipate a little bit of the future. This question comes from Dale Yamamoto. How bad does it have to get? Dale asks. Historically, how close were we to trust fund depletion when the 1983 amendments were passed? Curious who wants to jump in with the history and whether that's going to be Steve
Well,
or.
since Steve
Yeah.
could jump in. Steve was involved, and I was Alan Greenspan's assistant when they
Yep.
acted. So I certainly know the history. In the past, Congress has always acted right away. There was what happened in the 70s was there was an unanticipated immediate shortfall. Congress acted in 1977. It turned out not to be enough. They started to act again in 1981. It blew up because of David Stockman, a long story. But the bottom line is that Congress, the first time Congress has really not acted is recently, the last couple decades. And that's because I believe they've tried to go behind closed doors and cut benefits. If they do what the American people want, they could do it tomorrow.
Mhm. We've got some really great questions in here, so I'm going to take moderator's privilege and give us a couple of just a few extra minutes just to get through some of these because I think these are great questions, and I hope that's okay with
But
you, Steve. Yep.
could I just add just a tiny bit to
Yes,
what Nancy said?
please.
Actually, in 1995 and 2015, we were about a year away from the DI trust fund depleting its reserves, and Congress wonderfully, because it was easy, just reallocating some of the payroll taxes between the OESI and DI, keeping the 12.4% tax rate the same. We were able to do that very quickly and avert any problem with the DI. But Nancy's right. Back in 1982, 1983, it was a little bit harder. We actually, and maybe I shouldn't say this, but we technically reached the point of reserve depletion for the OESI trust fund in 1982. But there was special legislation before that had any impact to allow the OESI trust fund to borrow first from the DI trust fund, not from the general fund of the Treasury, from the DI trust fund, and also some from the HI trust fund. It was all paid back by 1986. So that is the time when we really came to the brink. And we are so hopeful we will not have such a brink in the future.
Steve, this next one's for you. Jason Seligman sends in this question. Hi, Jason. Thanks for being with us. Jason asks, Steve, what are your most current internal rate of return calculations? He cites a number of different actuarial notes covering this topic in the past, and he's curious if you have any newer thoughts or numbers to share.
I assume what he's referring to is we have a recurring actuarial note up on the web. Please again, don't be distant from that. That indicates both money's worth ratios and internal rates of return for people at different levels of lifetime earnings, and those are updated regularly. We haven't updated that for a while. One thing we were working on, and if Karen Glenn were here with us at the moment, she'd probably be throwing something at me for saying this. One thing we've been working on that internal rate of return, we hope to get out soon, is to indicate differential mortality for people at different lifetime earnings levels, but also differential probability of becoming disabled. Social Security is a package deal. It's not just a retirement plan. It's also disability and survivors. So people with lower income tend not to live as long, and that's oftentimes cited in terms of the value of Social Security. But people with lower income tend to have a higher possibility and probability of becoming disabled and getting those benefits. So we're hoping to have that added. And spoiler alert, the net effect of those two is not much different from what you will see in total for the rate of return for people on the rolls now in our current methodology.
Thank you for that, Steve. And I'm holding us over just a couple minutes because we have so many great questions. I appreciate our panel for staying just another minute longer because we've got so many good questions for folks. This next one comes from Mark Miller. Hi, Mark. Thanks for being with us today. And Mark asks, and this I think goes to the raising of the retirement age that Joel was speaking about, which has already been taking effect from the 1983 reforms. Considering that benefits of younger workers have already been cut approximately 13% by the 1983 reforms, to what extent does polling reflect that these people understand the impact on them of further cuts, either as a result of insolvency in 2035 or additional increases in the retirement age? So maybe a little bit of a complex question there, but I think I'm hearing in Mark some interest in whether people are aware that the retirement age has already been increased and is already impacting them, as polling asks them about whether they support further increases in the retirement age. And I'm not sure if anyone has any answers to that or thoughts.
Well, only that people clearly strongly oppose increasing the retirement age further. I think a lot of people do still think it's at 65, but in any event, they don't want any increases.
I would just add that, I mean, the polling, it's hard to get at exactly the depth of the feeling, but when you do focus groups, and we've conducted a number of focus groups around this topic, I think while people might not understand the exact idea, this is a benefit cut or this is not a benefit cut, I do think that people don't appreciate the idea of being, of the rules changing, and that they're being told, well, you have to wait longer. Maybe the previous generation could do it at this age, but you have another year, 2 years, 3 years.
Mhm.
So but it is a real challenge. I think people do have a real strong reaction when you bring this topic up.
And
It
a
has
lot.
a
Oh,
disproportionate effect on people of color. And so you'll see people of color who already are taking benefits earlier because they're in jobs where they maybe are not able to work as long, then getting an additional cut. And so the equity issue is very important to highlight as well.
yeah, and I'll also just put in a plug for the report that Joel mentioned, which is also on the Academy's website. It was the report released by the Task Force on Older Workers' Retirement Security that the Academy convened over the course of the past few weeks, past few years, that came out last fall, and also spoke extensively about the impacts that raising the retirement age further would have, especially for people working in physically arduous jobs.
Rebecca, if I might just add
Yes.
one little note on the retirement age, one thing that it really is, I think, significant, hopefully people will be aware of, there was a Simpson-Bowles Commission back in 2010. And one of the very interesting aspects of that, which is not part of the 1983 amendments for retirement age, was to not have the increase in retirement age apply across the board, but to not have any increase for people with long careers and low earnings levels, to absolve people from having any increase there. I think it was for people with a long career at earnings levels less than 2.5 times poverty. They would not have any increase under that proposal. So that is an option to consider for the future if, in fact, increasing retirement age is deemed to be a part of the package deal.
And Rebecca, I know there are a ton of questions, so I don't want to take any more time, but just one quick thought, and that is that it's been a sign of progress in civilization to reduce the amount of working time and over an extra leisure time, so that we now have a 5-day work week, we have 8-hour days and so forth. We could go back to 6-day work weeks, make everybody work on Saturday. That would help Social Security. But like raising the retirement age, I think it would be extremely unpopular.
So I'm going to throw in two last questions, and then we're gonna wrap it up. So one question is there are some folks interested in whether the panel or Steve or anyone wants to respond to an idea that's been getting a lot of traction in the last couple of weeks in the wake of the trustees report release, which is the idea of switching Social Security from its current structure to a flat benefit for everyone. I don't know if anyone wants to respond to that, but it's certainly been getting a lot of attention at some of the other events responding to the trustees report. So anyone on the panel who wants to speak to what that would mean or what their take on is on that.
Alf Landon proposed that in 1936 and lost in a landslide. That is not what the American people want. What Social Security is insurance against the loss of wages. It's wage related. They do not want a flat subsistence level benefit. They've showed that in 1936, and they're showing it today.
I wish we had Fleetwood Mac queued up to play Landslide now to give you your walkout music, Nancy. Does anyone else want to respond to that?
I mean, I always think that what makes Social Security so popular is that it's universal. And I think if it turns into a poverty program, that popularity, the fact that everyone pays in, everyone gets it, that is what makes it such a unique and popular program.
And honestly, let's look at where our poverty line is so ridiculously low. I mean, people depend on Social Security for what I think a lot of us would consider basic housing, ability to eat and do the things that they want to do. I mean, I don't think that people are excited about the idea of only having enough money to meet poverty. I think that's just not realistic.
It also makes me want to say that we do have a flat benefit program. It's called SSI, and Congress has not done a particularly great job of keeping that program up to date.
Amen, sister. I could talk about that for another day.
And that's a subject of many of our other Academy events, so I won't totally change the subject, but it does feel relevant here, right, as that proposal comes up, right? We're marking 50 years of SSI this year in 2024, and we're also marking 50 years since SSI's income rules were updated, 40 years since its asset limits were updated, on and on. So the last question I'm going to throw, and I think this may be to you, Steve, but others may want to weigh in as well, is does anyone have any comments about the need for and value of public trustees?
Well, I guess the only comment I would make is that the law suggests we should have public trustees. It's useful to have a wide range of discussion. I have to tell you that the the ex officio trustees we've had, secretaries of Treasury, Labor, HHS, and Social Security Commissioner, have always been very balanced and have always looked at the trust funds in a very appropriate and balanced way. Having public trustees in addition is a good thing, but I think we're doing well even in this time without them for several years. Hopefully they will be restored. And sorry, Nancy, you were going to
No,
speak.
no, keep going. I think that's right.
Anything you want to add, Nancy?
Um, no, I think Steve said it right. Most of the history, there were no public trustees. They were added by the 1983 amendments in a sense of restoring public confidence, but I don't think they've played that role. I think it's fine. I think we're doing just fine if they, again, I think it's in the law. They're currently vacant. I think Congress will eventually put them, but we're doing, as Steve said, we're doing fine with that.
And I would just hope that all would agree that the transparency of the trustees and the trustees process is really paramount. Ever since 1941, the annual report comes out. It is addressed to the Congress, to the Speaker and the President of the Senate, and there's always plenty of opportunity to be able to talk about it. We have debates and discussions about assumptions, et cetera, et cetera. There are competitors out there with their own projections today, but I think one of the things we point out is over the last 13 trustees reports, we've projected the reserve depletion date for the combined dual SDI trust funds to be between 2033 and 2035. We've had a very consistent record. And a very accurate record, I would suggest, in terms of our projections. So it's appropriate that Congress requires the trustees to provide these annually and then acts upon them when needed.
I
And
think the key, transparency is more important than public trustees are great, but transparency really is what the American people should have.
And today's webinar is a great example of that, Steve. Thank you for joining us for this. Thank you for your wonderful slides. Thank you for helping us understand and put in context what the trustees report this year tells us and where it all comes from, and the showing your math, right? Showing your numbers as we were taught to do in high school, or I suppose showing your work, right, would be the thing we were told to do. Steve Goss, Chief Actuary over at the Social Security Administration, Nancy Altman with Social Security Works, Tracey Gronniger with Justice and Aging, and Joel Eskovitz with AARP. Thank you to everyone for joining us today, and thank you to everyone who joined us out in cyberspace. You can go check out the Actuary's website, as Steve mentioned, ssa.gov/OACT, and you can find all the goodies that Steve was sharing today. And we really appreciate everyone joining us today. Thanks so much, everyone. Have a wonderful day.